Hi, my name is Courtney Arroyo, and I'm from the Department of Emergency Management here in Fairfax County. I'm the Assistant Coordinator for Communications and Community Engagement, and you're joining us for our webinar for November of 2024. So we are going to be joined today by our health department. This theme for this year is preparedness through partnerships. So we've been hearing from a lot of different agencies and organizations that have roles and responsibilities and also help us to prepare for emergencies. And the health department is one of those partners. So I am joined today by them, and we are going to learn all about preparing for your health before emergencies. So I'm going to kick it over to you, and we're going to have some great session about learning about our health and emergencies.
Great. Thank you so much. Thank you, Courtney, for the invitation, and to the Department of Emergency Management and Security for having us. My name is Kadambari Sridhar. I am with Fairfax County Health Department, and my position is Community Preparedness Coordinator. I work under the Division of Emergency Preparedness and Response, and we work very closely with DEMS and other community partners to make sure that our community is prepared and have the resources and information needed to be able to do so. So for today, we're going to focus a little bit about health preparedness made simple, with a particular focus on those that live with chronic conditions. For the millions of Americans living with chronic health conditions, it's very important that you plan ahead and continue your care for whatever is the condition during an emergency. As you might know, disasters can happen without warning and can impact the ongoing needs of people with chronic conditions. This presentation outlines some measures that you can take to ensure your medical needs are met during emergencies, as well as preparedness tips for people with some of the common chronic conditions. So consider in this slide how you will meet the following needs during an emergency. Start by identifying the specific health needs that you're going to need, and think about what sort of medical services, treatments, and other health needs may be interrupted during an emergency, such as a hurricane, flood, fire, power outage, or a disease outbreak. Some questions to consider would be if you receive specialized medical care, such as dialysis or chemotherapy, have you located additional backup treatment centers? Do you use any battery-dependent equipment or assistive devices? If so, do you have a plan as to how you will operate these in the event of an emergency? Do you have an extra supply of medications and know how to request emergency prescription refills? Do you know what supplies you may need if you need to leave home quickly? So let's start about thinking about a few of these things with respect to some of the specific chronic conditions in the next slide. In the United States, there are 5 to 6 chronic conditions that are more common, as it affects a big majority of people that learn and deal with managing some of these conditions. For example, heart disease and stroke, diabetes, lung disease, kidney disease, and cancer. And you'll notice like some of the terms like heart disease or lung disease and kidney disease can be a combination of several different conditions that come under that umbrella. And then it's important to know how you need to learn to manage that condition with specific to your specialized health need or the health need of someone that you're caring for. Let's start with heart disease and stroke. With heart disease and stroke especially, it's important to know the signs and symptoms of heart attack and stroke. And as always, make sure to call 911 immediately if you're showing any of the symptoms. For clarity, I've included your Stroke Smart signs. It's an interesting magnet, a flyer, information that you can also find on our Fairfax County website, which shows the signs you can use to immediately understand if someone is suffering from a stroke, and so you're able to call 911 or seek help immediately. What's important to note is stress from a disaster or emergency may increase blood pressure and worsen symptoms of heart disease. So it's important if you are living with heart disease to make sure to monitor your blood pressure regularly, and also make sure that if you're caregiving for somebody with a heart condition, to monitor their blood pressure. When it comes to heart disease and stroke, I stress the importance of keeping very specific things as part of your emergency kit, and then have a plan in place on who gets to use the items in the emergency kit, and make sure if someone is your caregiver, they're aware of the components of it. For example, your medical information, such as your very specific health condition, if you've had surgeries in the past, any implantable devices like a pacemaker, specific medications or allergies to medication that needed to be noted, and a contact information for your adult congenital heart disease center, for example, or an emergency contact for your primary care physician or your cardiologist. When it comes to medical supplies, some things that are useful to hold on to in your emergency kit would be an oxygen canister if you're dependent on oxygen, a CPAP machine, any breathing treatment equipment, an implantable cardioverter defibrillator, a pacemaker transmitter, personal hygiene products to make sure that they're disinfected regularly, extra clothing, and non-perishable food items. If you specifically have a pacemaker, it's important to carry a pacemaker ID card in your wallet, purse, or a phone case, or you can wear a pacemaker ID bracelet for easy identification. Make sure that you do have copies of your prescription medication in the event that you need to access an emergency prescription refill. If medications are to be taken with the meal is when we stress non-perishable food, and also to keep a small cooler or an instant cold pack in the event your medication requires refrigeration. Here, I would also stress having a plan for power outages. Alert your power company and fire department about any medical equipment needs power. For example, an oxygen concentrator, a nebulizer, a ventilator, a CPAP, or a BiPAP machine. Make sure your electronic devices have a full charge in the event of a power outage, and you can consider purchasing a backup power generator to provide emergency electricity. Keeping an extra set of batteries, especially specific batteries for your durable medical equipment that you're using. Car adapters if you need to quickly take your go bag and use some mode of transportation. And also make sure that those batteries are kept fully charged. And it's important to kind of recheck that every 6 months or so is the recommendation that we give, particularly when you're living with a medical condition. Now, talking about diabetes, that can come with a different set of challenges. Managing diabetes can become a lot more difficult during a disaster because you may experience a lack of access to healthcare, medication, clean water, electricity, and insulin storage, particularly if you're insulin dependent. Similarly to heart disease, stress from emergencies can lead to blood sugar spikes as well. So advanced planning is key to managing a condition if you're living with diabetes. Some of the things that we recommend including an emergency kit would be insulin and syringes if you're insulin dependent, and particularly if your insulin needs to be stored at a certain temperature to keep an insulated cooler, instant cold pack, and have a little paper that talks about your storage instructions for the insulin. Extra diabetes supplies will include testing strips, lancets, a glucose meter to ensure you're monitoring your blood glucose level, insulin pumps, and extra batteries for your glucose monitoring machine. Include also information if you have a glucose monitoring machine on the manufacturer, the make and model, serial numbers, and medical equipment. So in the event an emergency, medical personnel have to review your equipment, they have the necessary information in order to do that. For folks living with diabetes, it's always important to pack sugary snacks because it's easy to become hypoglycemic or experience low blood sugar levels in case of an emergency, or if you haven't had a meal, if you haven't been able to take your insulin injection on time with your meal, for example. An empty plastic bottle to hold your syringes, needles, and lancets. And also make sure you have your medical and treatment information updated. Especially with diabetes, your condition can change rather quickly. So Every time you're with your primary care provider discussing management of your condition, make sure you understand your current prescription, your dosing instructions, and the prescription numbers. Always include emergency contact lists like name, address, and phone number. And here I want to point out that the FDA has guidance on refrigeration of insulin. So according to them, insulin may be left unrefrigerated at a temperature between 59 and 86 degrees Celsius, Fahrenheit for up to 28 days and still be effective. But for you to understand how the adequate storage instructions are maintained without compromising the effect of the insulin, I would recommend that you go to fda.gov and then look up information regarding insulin storage and switching between products in an emergency. So that will give you a little bit more information and guidance on the specific types of insulin you might need to store in your emergency kit, which may differ from what you're typically used to when you're dependent on a specific refrigeration or a cooling mechanism for it. Now let's switch to lung disease. Lung disease is an umbrella term. It can include conditions like COPD, chronic obstructive pulmonary disease, asthma, some severe allergies or other respiratory conditions that can be a little bit difficult to manage when you are faced with an emergency condition. Some of the things to take note of, particularly around your surroundings, is to be aware of environmental triggers in your region. Some things that can trigger your lung disease will include extreme heat or frequent temperature changes, pollen, poor air quality, and products in the environment such as smoke, fumes, cleaning products, high winds, etc. So kind of think about how do you get the information needed for you to make the decision as to how to be prepared depending on your specific condition. In order to check air quality, you can sign up at airnow.gov, airnow.gov, and it gives you current forecasts about unhealthy air, and that give you some decisions on whether you need to travel, you need to stay indoors, or figure out the best way to be able to manage a condition. If you're able to remain at home and you're dealing with extreme weather conditions like unhealthy air and poor air quality, think about investing in an air purifier in your house and keeping doors and windows closed in case of that specific condition. Some of the things that you can include in your emergency kit would be, just like the previous conditions, your prescription and over-the-counter medication documentation, something that is up to date to your most recent condition. Any applicable medicine delivery devices. And when it comes to lung disease, you can think about a nebulizer, a spacer, portable oxygen, or any other mobility devices that help you get through your day. Contact information for your medical providers, especially those that give you that durable medical equipment, such as oxygen. A peak flow meter is something that you might want to consider investing in if it's prescribed by your healthcare provider. You can also think about including a well-fitting mask, and for example, an N95 respirator mask. If you've been fit tested for it, consider having more than one of those N95 masks for you to use on the go. That will not be too hard for you to put on if you need to step outside of your home. Ask your provider on how to make sure you can have enough equipment and supplies during and after a disaster or emergency. For example, it's very important to not reduce your oxygen flow rate to extend the life of your battery or oxygen supply without talking to your healthcare provider about it. So as and when you go to manage your condition and check with your primary care provider, it is important to also talk to them about what is your disaster or emergency plan and what are some ways in which your provider can help you manage it when they are not easily reachable and you have to adapt to some changing surroundings. One quick tip I'll offer you, especially for lung disease, is many new nebulizer models can be battery powered or used with a car adapter. So consider asking your healthcare provider if a similar medication can be used when your typical nebulizer does not work as well. Lastly, I will say, think about making an asthma or a COPD action plan. So you can receive that plan information online and look at how you can fill that out through the American Lung Association's website. It's also available at www.lung.org. Now, coming to kidney disease. During a widespread disaster, treatment centers and hospitals might not be able to provide dialysis treatments right away to support services that may or may not be available. So it's important to think about having a well thought out emergency plan, especially if you're receiving a dialysis treatment. Be prepared to manage your condition during an emergency, especially if you need to think about missing a dialysis treatment, if you need to evacuate to a safe location, or you need to think about a situation where your typical treatment is being disrupted, such as in the event of like a major storm and your dialysis center is closed. So always talk to your provider first and foremost on instructions for continuing home dialysis treatment during an emergency, and make sure you stay in contact with your provider or the contact information that your provider has given you in order for you to be able to do that home dialysis process. And an emergency should not be the first time you are doing a home dialysis process. Think about ways in which you might be able to practice it with close proximity to your provider so that you get a lot more familiar with that. The more and more you're dealt with that situation where you have to be adaptable. Another thing to think about with kidney disease is looking at developing a support network that are aware of your specialized medical need and the responsibilities that they may need to take up in order for you to be supported. For example, they may serve as a backup plan for transportation so that they have the ability to come and pick you up and take you to a treatment center, especially if your typical treatment center is closed or you're stranded somewhere and you need the assistance from your support network. Now is the time to kind of start thinking about what that support network looks like and in what capacity they're going to be able to support you in case of an emergency. Similar to what I talked about with heart disease and any kind of like power dependent items that you are in possession of to manage your condition, think about your water and power companies and if they have like a priority restoration list in case of a power outage. Make sure your condition is on there in their restoration list so they can prioritize your needs in case of a power outage. Some things to also include in your emergency kit would be, just like your other conditions, a list of medications, updated prescriptions. If your medication is refrigerated or needs to be refrigerated, then think about having a backup insulated cooler and instant cold packs. Make sure to always have your treatment information for kidney diagnosis. What was the last treatment? What type of treatment you received? Medications, allergies, and that specific medical history with this condition and any supporting conditions that may affect your kidney disease. Contact information, not just for your medical provider, but also the dialysis centers, your actual one, your backup dialysis center, which should be more than one, including names, address, and phone numbers. Essential dialysis supplies can also be included, like specific medical equipment, and then many different versions of that medical equipment in case one of them fails. One thing that will help you is looking at the National Kidney Foundation, where a sample emergency meal plan can be found if you're expected to maintain a very specific diet, particularly non-perishable foods and water that need to be consumed as you manage your condition. And if you're also stressed with dealing with identifying a backup dialysis center or have to do home dialysis, make sure you're also paying special attention to your diet and water and the things that you're consuming. The last thing we want is to not make your condition worse than what it already was, particularly when you're also stressed out during the emergencies. And that's, no more true than something as sometimes long-standing as cancer. Cancer treatments like radiation and chemotherapy can also weaken your immune system and make you more vulnerable. And it's very important to have a plan in place to avoid any disruptions in your scheduled chemotherapy or radiation sessions, especially cancer treatments these days that have a very specific regimen and a rigidity to it. It's important to discuss with your medical provider what are some alternatives that you may have to be prepared for in case of an emergency when you're not available for your scheduled chemotherapy or radiation session. Well, one quick tip is to make sure you can always articulate or have it documented your exact cancer diagnosis, what stage of cancer you're undergoing, or the person you're giving care to is undergoing, what is the treatment plan recommended that you're following, and if you need to receive emergency treatment somewhere other than your usual treatment center. Some of the things, especially with a weakened immune system, that you and your household can take, especially when you're going through cancer treatment, is following recommended health and safety guidelines to prevent infections. The last thing you want, again, is to have your emergency get even worse than the specific condition that you're trying to manage. So some things that we recommend as a public health agency is always wash your hands frequently. Avoid any large crowds, especially unknown crowds where you don't know what type of infection you're going to get from large crowds. Another thing would be similar to lung disease, wearing a well-fitted mask if you need to be outdoors or in close proximity to other people, and also to stay up to date with recommended vaccines and immunizations. Vaccines not just for your routine immunization that are age dependent, but similarly also thinking about emerging infectious diseases like COVID-19 or flu, and making sure you're well protected to manage it and not make that affect your actual cancer condition. When it comes to your emergency kit, I always, again, recommend an extra supply of medications, especially with the cancer treatment and oral chemotherapy. You may want to discuss with your provider if there are specific medications that you can receive backups of that you can hold on to within your emergency kit. In addition to your medical history, make sure you have contact information of your medical providers and treatment centers. And then always keep some sanitation supplies like masks, hand sanitizers, gloves, soap, alcohol wipes to be able to prevent any kind of contact infection. If you want more information on emergency preparedness resources, you can also go to the emergency resources for the cancer community, NCI, and then look at what additional recommendations they may have specific to any type of particular cancer diagnosis. So we talked a lot about our physiological conditions, the chronic conditions. So I want to kind of switch a little bit to lastly focusing on your self-care plan. As you may have seen from this presentation, an additional thing that worries people, in addition to managing a chronic condition, is managing it when a disaster strikes, in case of an emergency, in an unfamiliar surrounding, when you don't have the typical support networks or the support systems in place. So kind of think about what your self-care plan is going to be, with specific focus on safety, medical needs, mental well-being, and effective communication. Some things that you can do is kind of being open with your support network about your specialized medical needs, kind of get that conversation comfortable, make sure that people understand specific medical terminologies if they are, in a place to be able to provide care for you as and when a disaster strikes. But from a preventative standpoint, I would also recommend keep your regular health routines like regular checkups, taking prescription medication, exercising, building a practice around self-care ongoing. So some of the things that you can do is staying connected with your friends, neighbors, caregivers, not just for like their physical, tangible support, but also for the emotional support during stressful situations. And lastly, I'll recommend in your emergency kit keeping some comfort items that may help us relax and reduce anxiety. Things like photos of your family, a favorite blanket, music, games, books, etc. Whatever it is that can make you give a sense of calm and grounding, especially when things are unfamiliar. And I cannot stress enough the importance of communication. Kind of decide how you will stay in touch during an emergency, especially if you're separated from your typical support networks that you are routinely used to. And it's a good idea now, today, to identify someone outside of your area to be a main contact to help your household members reconnect in case of, a situation where you guys might be separated for whatever reason. Always keep a list of household members, contact information, emergency contact, neighbors, and healthcare providers. Make sure your phone and communication devices are charged, and be sure to have a backup source or a battery pack in case you have more than one device that you need to access. And this is my plug now to sign up for local emergency alerts and know how to access disaster information through the radio or phone. Fairfax Alerts, that is run by Ready Fairfax, and DEMS does an incredibly good job of keeping the community alerted. So if you haven't already, go to the website fairfaxcounty.gov/alerts and then sign up to be able to pick and choose the types of alerts and information that you need to do. And lastly, if you have any questions for the health department, we're always ready and available to act as a trusted and verified resource. If you have any specific conditions, whether about navigating your chronic conditions, navigating resources within Fairfax County that might better help you understand the chronic conditions that you or someone in your household is dealing with, do not hesitate to contact me. You can reach me directly on this email address, which is HD Health Department EPR, Emergency Preparedness and Response, at fairfaxcounty.gov. Very simple, type a note, and we would love to hear from you. If you have any specific ideas on how you can make this presentation better, reach it and amplify it to more people, please share this with them and share your questions, comments, and feedback with me as well. And once again, thank you so much to Courtney for hosting me, and feel free to reach me. Thank you again.
Yeah, thank you so much for all the great information. It's a lot of great information that we just need to be reminded of, especially if we are dealing with chronic conditions and health conditions. And especially after the recent disasters that we've just seen, we can't stress how important it is if you are displaced or if you're going through an emergency situation, making sure that you're advocating for yourself and letting people know what you need and how they can help you, because there are a lot of resources, but we don't know what we can help you with if we don't know what you're missing. So make sure that you are advocating for yourself. Having that documentation ahead of time is so helpful. It makes a lot of our processes go a lot faster. So during an emergency, I'm sure you'll see, if you ever experience one, Kadambari and I have pretty big roles in when people are displaced. So we're really happy to be working on the back end to make those processes and procedures as painless as possible, and to help the residents as quickly as possible as well. Well, thank you so much for joining us. This is going to conclude our webinar for November, but we will see you at the beginning of December.